Hi there. I thought that I would come back and tell you all about pessaries and how to use them, because after I posted that I had done a course on pessaries, I got some messages saying, what the hell is that and how do you use that for pelvic health patients? So pessaries is an internal support device that you use in people who have a pelvic organ prolapse. So if you think about a device that's like a brace that you wear on your elbow or on your knee, that would be an external support device. So pessary is sort of the same thing, but you just wear it inside the vagina. So that's why I think of it as an internal support device. So prolapses is something that happens when the walls of the vagina move more than they should be moving. So that could either be at the front, where the wall is moving into that vaginal space, and that would be the bladder pressing into that vagina, or the back, where the rectum would be moving forward, or from the top, where the cervix and uterus might be moving down, or if you don't have a uterus anymore, and you just have the vaginal cuff at the top, that might be coming down. And people will describe that often as a bulging feeling, or feeling a lump, or feeling a dragging or heaviness, or sometimes just a little bit of discomfort or pain in some cases, where things just don't feel like they felt before. And a pessary is a great option to actually help manage symptoms. So I'll show you some different types of pessaries and how we actually fit them in the vagina, and how we then can help potentially symptomatic relief from having a pelvic organ prolapse. So I've got this little demo vagina and this is just a tube, and if you look up the tube, this one has a cervix at the top. So we need to know that the tissues are healthy, so we need medical clearance before we can fit pessaries. And we'll do an examination ourselves to look at those tissues and to measure the area inside the vagina. And the measurements determine the size of the pessary, because you get different sizes of the same type of pessary. One of the ones that we are most likely to start with is called a ring pessary, so it looks something like this. This one has a little knob, but some of them just come without that extra bit, so it's just a total ring. Something like this you would lube up after having done your examination, after knowing that the tissues are okay and would probably cope with a pessary inside, and you'll squeeze it and you fit it through the vaginal opening and putting it in. The one bit goes behind the cervix or towards the back of the vagina, and the bottom bit sits just tucked in under the pubic bone. So it sits at an angle like that, and that helps just to sort of support those tissues on the inside. And for a lot of people, it actually is a major help in helping to manage their symptoms and get them just having a better quality of life. It's actually really comfortable if it's an appropriate fitting pessary as well. We obviously fitted these things on each other, so we all could feel how it should feel inside, and it shouldn't actually be uncomfortable or hurt when it's fitted correctly. A ring, for example, could stay in for an extended period of time. When we do our fittings, we bring them back within a couple of weeks to remove it and have a look at the tissues and make sure that there's no damage to the tissues. And if everything looks okay, then they can leave it in for longer periods, and we extend that time period between following them up for pessary checks specifically. It's something that they could take out themselves as well, so if they desire to take it out, give it a wash and put it back in, we can teach them to do that. So a ring obviously has space, so someone could still have intercourse with it in place, and vaginal discharge and things can still come out, so that's why it can stay in place for a longer period of time. I'll show you some other types that we went through and tried out. So this is called a Gellhorn. This top flat bit will suction onto the cervix, and then it's got a little knobby bit that could either be short or a little bit longer, and this would be pointed backwards, so it supports the back wall of that vaginal space. It's a little bit more difficult to get out because of that suction it creates, but it's not impossible to get it out yourself. Something like this, someone can't have intercourse with while it's in. So this would need to come out when a person is sexually active. So it probably wouldn't be the first choice in a person who is sexually active. There's other choices that we'd probably rather go for. It does have little holes in, so it does allow drainage to happen. So if someone is not sexually active and they don't want to take it out themselves, then it can actually stay in because it does allow drainage to happen. And then the last one I'll show you is a cube. So this one is a space occupying pessary. So as you can imagine, when that sits inside, it supports a lot of the walls. It also suctions onto the walls, but something like this needs to be removed every day, and a person sleeps without their pessary and puts it back in the next morning, because this one doesn't allow drainage to happen. So just so that the vagina can clean and everything that needs to come out can come out, this one comes out daily. And then I will say that pessary fitting needs to be done by someone who has had proper training, and it needs to be followed up appropriately, because a neglected pessary can actually cause really big problems. So if you have any more questions, please send me a message or leave a comment below, and I'll get back to you and answer your questions.